Good. Thank you, Bill, and good morning, everybody. You don't have to shout good morning back. And to people watching online too, who are joining us too, welcome to them as well. I do want to say several things. I'm afraid I can't run right through the achievements and progress. There's, I think, too many achievements. But I'm going to give you highlights of this, and I hope the annual report gives you more of a flavour, just as we heard before in the annual general meeting, that this is what we said we'd do, that's what we've done, and that's where we're going. So that's what I hope we can do, what I can do in this talk. It's been a good year since we last met at the conference in Nottingham, and it's good to welcome new people and good to welcome old friends back. There has been some important progress, but, and I can't overemphasise this, we as a team and as a group and as a charity, we will not be satisfied until we have effective treatments, good quality care, and independent and full lives for all those affected by muscular dystrophy. Okay? So what we've done so far is important, and we're really pleased, and we're grateful for all the support, but it's a step on the way to where we need to be. I don't want to lose sight of that. So I'm going to look back and note some of the highlights, but first, as Bill said, I think it's appropriate that we do think about, just for a moment, about Lord Attenborough. And of course, we do lose loved ones, we do lose colleagues, we do lose people who are part of this fight, and we don't normally pause, so perhaps this year, for once, we can just think about that while I just run through my thoughts about Lord Attenborough. So, I put up a slide there showing the sort of bare numbers about Dickie Attenborough and the contribution he made to us. But in a sense, the numbers don't really tell the story, do they? A charity supporter for more than 50 years, a vice president, somebody who was recognised for his work in this country and abroad, knighted, a life peer, member of the House of Lords, our honorary life president, and he raised hundreds of thousands, if not millions of pounds, for research into muscular dystrophy. And he was more than that, wasn't he? We heard in the tributes to him that he was an outstanding actor, a man who appeared in films, who produced films, who directed films, BAFTA-winning films and Oscar-winning films. And more than that too, he created the British Film Institute. He ensured its survival, BAFTA itself, theatre, huge contribution. But perhaps, above all, was the humanitarian impulse. Here was a man, I think, who couldn't see an injustice without feeling a sense of responsibility to do something about it. And when he was working for us, as a volunteer, of course, it all started back in 1962, and he frequently told the story of going to this hospital fete, asked as a star, as a film star, to open the fete. And he said he couldn't forget the boys he'd met there, who he knew, as he'd been told, that some of those boys would not be there the following year. And he compared that with his own family and the life they hoped to lead. And he rang the office on the Monday after that visit on the Saturday. He rang and said, "Is there anything at all I can do to help? Let me know." And of course he stood by that. And he was a constant support to the charity. And on the top left of this slide, you see him actually in the office opening the mail because an appeal was taking place. And he was really keen to know how much was being raised. Was it going well? On the right, he's there in a lab. It's probably Kay Davis at Oxford, looking through the microscope, looking through the kit there, huge kit, looking at muscle cells and understanding research, motivated by research. But perhaps at the bottom on the left, the most telling slide, with families, with children, where he, I think, was happiest and gave so much. He said at one point, that he had gained so much from the charity, and what he gave was so little, but that I don't think was true. And here we have some words which I think sum him up. "I've never forgotten learning at first hand of the impact of muscular dystrophy and being so moved and indeed distressed to find there were really no effective treatments and indeed no sign of a cure, even on the far horizon in those days." And the fact that our world's a little different today is largely thanks to Dickie Attenborough, the people he brought in, the people he inspired, and all the families and supporters. So I think it is appropriate that we do pause and say a huge, huge thank you to Dickie Attenborough. Okay, I think we should just show it in the usual way. And while we feel his loss, clearly it's felt most keenly by his family, and our thoughts do go with them. we are very fortunate that his son Michael Attenborough is now a vice president of the charity, and Michael's wife Karen is a strong supporter too. So that family connection has been maintained, and I'm delighted that that is the case. So moving on now, you've already heard this morning about the financial position. So if I was just quickly to summarise it, I don't want to waste time. Our income last year in round terms, 6.7 million, a good increase on the previous year, which I've shown there. Our surplus, a very good 1.8 million compared to the previous year, more than 3 times, meaning we now can make a greater spend on research and on support and development of care. And you heard too, we've set aside a further £850,000 of that for future research, so planning ahead. And that's down to the very strong fundraising performance from our supporters right across the piece and the fundraising team, and also our legacy income. Those long-term supporters who are prepared to make a longer-term commitment makes a huge difference, so we are very pleased indeed with that. And when we look at the wider impact of the charity, you know, some charities would put the value of the work they do in improving care, if they're developing government contracts, they put those contracts through the charity's books. And it's quite legitimate, they're entitled to do that, but we don't do it in that way. We are growing services, we're putting more support in place, but we make sure the NHS in this case pays for that support. But if we were to put a figure on the impact of our work in terms of growing clinical care support, if we were to put a figure on the advocacy service and the work we're doing there, in putting in aids and adaptations, care packages, we find the total impact of the charity is more like £10.9 million. So I think that's a number I like to bear in mind, because we are an important charity, we are doing very good work, excellent supporters, and we are making a wider impact. And therefore it is appropriate I say thank you again to our many supporters. Aileen Stewart on the top left there in Glasgow for the Commonwealth Games. Sir Alex on the right, supporting us again in September at a major fundraising event in the city. And bottom left, an example of our runners. Huge commitment from supporters from all walks of life. But it's important, isn't it, that we do reach out more widely. I was struck by several things that Gary said before me, but not least that we are stronger together. But one of the challenges we face is that we, in terms of muscular dystrophy, we are very important but rare conditions. And we know that there are about, 70,000 people affected by the conditions. Now that's 0.1% of the population. So I'm not very good at maths, but I think that means 99.9% literally don't have any direct connection. If we think about families and friends, we could probably increase our percentage by 3, couldn't we? But still, 99% of the population don't have a direct connection with us. So our challenge is still to reach out to more people. And therefore we've been looking very carefully and very seriously at our name and how we look. The visual look of the charity is the more we can do. Can we actually evolve our look? Can we evolve our logo even? And so we're looking today to share your ideas and views. And Rebecca Day, our Director of Development, has a stand outside, some poster boards, to talk you through the changes. We'd like you to spend, if you can, just a few moments with Rebecca, have a look at the changes and give her your feedback. So we're really keen to hear what you think of our thinking on this, because we're keen to update our key messages, how we describe muscular dystrophy. We want to evolve how we look, and we're really keen to introduce a campaign theme that people can understand right away. So that's what we are keen to do. We want your views on this. What's the timescale from here? Because this is an important day today. Well, we've been meeting with our councils. I'm going to Northern Ireland in November to meet the council there. We've met with the Scottish Council in September. We talked about this at the Scottish Conference last week. We welcome your views here today at the National Conference. Our trustees will then meet in December to pull all these views together, to hear what people think of this, and then come to a view as a board of trustees and take a decision. Whatever the decision, we'll let you know what we're thinking, and that'll be in January. And if we do decide to make a change, do evolve this, push on and try to reach more people, particularly potential supporters, those companies who have those Charity of the Year pitches, where often we don't quite get in there, and the better well-known conditions get in there before us. Those are the sort of people we're keen to reach with this. If we do make the decision to go ahead, after we've heard all the views, we'll be looking to make this happen from mid-February. So we're really keen to push on, subject to what people think. Now, you've heard us talk about the work of the charity, and I like to think of the 3 pillars. So for those of you who like Greek or Roman columns, there's 3 pillars to our work. And actually, it's quite simple, isn't it? We're looking to support research, seeking treatments and ultimately cures for each of these conditions. In the meantime, we want the best possible clinical care, specialist care available for people from diagnosis going forward. And there's a need, isn't there, for support for independent living, to live the kind of life you want despite the muscle condition. And again, I think it's going to be a theme throughout the day that we can't do this on our own. We'll give leadership, we'll drive forward, but we need partnerships. The job is too big for a charity of our size. And even if it wasn't too big, it's right we should involve people in this. We are inclusive. We're keen to bring people together, and we can do that. And if I could emphasize a point that Bill made earlier, we've just had our AGM, this is our national conference. It is your charity. We are a democratic organisation. You have the final say on the trustee board. So do join. There are sort of simple forms on the registration desk, or let us have your names and addresses. So we're really keen to grow our membership. But let me move on. I spoke about being with you from the start of the journey. I think that's really important. And so here on the right of the slide, you see a diagnostic slide. It's looking at inclusion body myositis. So anybody with a clinical background might recognize that. But the important point is this, that for some people, diagnosis is delayed, isn't it? And delay is uncomfortable. Delay is distressing. It makes it more difficult for you. And we are here from before the diagnosis when that condition is suspected. We've got information, huge information resources, which we constantly update. And we've got a free phone helpline. So I do want you to feel that you can contact us. We have an advocacy service. I've already spoken, haven't I, about the impact of the advocacy service. It's not really about generating funds, is it? It's actually about supporting people to live full lives. It's about rights. It's about what you're entitled to. And then we have the family funds. And I thought Gary made my point so well in his talk. But often at the point of diagnosis, when there is no treatment, you say, right, I'm going to do something about this. Don't accept that. We'll raise funds for research. And we have been setting up family funds. And there are many, many of these funds now. And I think they're a fantastic idea because you've got the enthusiasm and the energy in the families to take this forward, and we can take care of the headaches of taxation, of the legislation, of charity law, having to register with the Charity Commission. Don't worry about that. Form a family fund and come with us, and we'll look after that. And our local groups as well, there to give peer-to-peer support. So I think we want to emphasise that we are here right from the very start, at every step on the way. And speaking about advocacy, we have our legal partners now. On the left, Hogan Lovells, done great work with us. They're keen to do more, and they welcome working with us and tackling these difficult cases, which in effect are cases of discrimination, and they'll take them on with us, and there's no charge for this. We've now launched the second partnership in Scotland with Anderson Strathern, a leading company, offices across Scotland in the major cities, and the chair of the firm was at our Scottish conference last week for the first time, and thrilled to be there, to be helping us take the fight forward, to get people the support they need to lead full and rich lives. And of course, we are really keen to reach out to communities that perhaps are harder to reach. We're here for all people. That's the key message, for all people. And we are in touch with local needs, and we're working increasingly with the muscle clinics and building partnerships with the healthcare staff, with the consultant and the clinics, reaching more people right at that early point, and linking with care advisors. You know, the care advisor team has grown, hasn't it? When I first came to the charity, it's 8 years now, I think we had 12 care advisors, and we had to raise the funds for them. Now there's a national network of some 47 care advisors around the country. The numbers will increase, and the NHS is paying for every one of those care advisors, a national network now. And of course, when we do carry out work like this here, and this photo is from Bradford, and I was there last month, and this is a great new project. Awaz, it means voice. And here are a group of mothers who came to us to say, can you help us? We have people in our community who need more support, who need your support. Can you help us do this? We've put this together. And it's backed by external funds, by Comet Relief and by Sovereign Healthcare based in Bradford. And it will provide, like all our groups do, peer-to-peer support. And we're looking to improve quality of life, aren't we? And then share good practice around the country. And I think it's entirely right. We spoke about electing trustees and the balance, Northern Ireland, Scotland, now Wales, we hope. But also the Board of Trustees and our committees should reflect the wider community, not just geographically. And I think the Awaz project will help us do that, to take the charity forward, to reflect a modern Britain. And that's just so important. And I'm sure we can do that. And of course, we have to bear in mind that neuromuscular services, healthcare and social care is devolved. So we don't just have one government to deal with, not just one health system, but there are 4 health systems across the 4 home countries. And I hope the chart gives you a flavour of the work we're doing. And as we grow our services and grow the Care Advisor network, and I think we're having a session this afternoon, looking at the slide here, with Emily Ballard on. Emily's leading a session on respiratory support. We've introduced the Department of Health funded Bridging the Gap project, a major piece of work. I'm just so pleased with the work that's going forward here. And there'll now be on our new hub shortly a GP e-learning module. How often have we said that the GPs don't understand muscle wasting conditions? They don't get muscular dystrophy. They miss it at diagnosis, so we're having a GP e-learning module. There'll be an online training tool for physiotherapists, and we're going to shortly have the first UK-wide map of services to be accessed via our hub on our website. And we're campaigning too for access to hospice services and respite care. One of the really positive things is that people are living longer with muscular dystrophy. People are living longer with Duchenne in particular. It's a really positive step, and we very much welcome that. We've been driving this. But of course that creates then its own issues, doesn't it? Because people, younger men with Duchenne, no longer boys, need access to hospice care. And the children's hospice may not be the right place. In fact, I think we can say with some confidence it probably isn't the right place. And their families will need respite support as well. So we're taking that forward. And specifically in Scotland, we've been driving it through the Scottish Parliament, through our networks there. And we've now secured a commitment from the Minister of Health in Scotland to hold a roundtable meeting to identify how they will take forward the need to support young men with Duchenne who need access to hospice and their families need respite care. And with the Trailblazers, we're tackling independence, aren't we? Removing the barriers in society that hold people back. Because many of the barriers are, in fact, avoidable. They shouldn't be there. So the Trailblazers do fantastic work on removing barriers. And I need now to just turn to research and look at the huge impact we're making there. I was reflecting when I talked about Dickie Attenborough, about the work the charity has done since Lord Attenborough helped raise so many funds to fight muscular dystrophy. And with his support, and with many, many people, with the branches, with the groups, with many people, we established the infrastructure that we still see in place today. We put in basic grants to Newcastle, to London, to the specialist centres. We helped put that in place. We helped support geneticists identifying the genetic causes. And we've supported young scientists over many years, building for the future. And we've done that. And, you know, we gave the first grants to Professor Dame Kay Davis, now at Oxford, with her Dystrophy work. And we backed right from the start Professor Bushby at Newcastle, at the centre there. So the charity's got this proud, I think, and strong track record, a good history. And we need to build on that going forward. Because there is a sense in which history is important, but it's more about what we can do today and do next week and in the future, isn't it? We shan't live in the past, we're going forward. But we have done that, we've achieved that. And we're now putting in place international collaboration. So we've established a partnership with our French sister charity, the AFM. And we shall make a call in partnership with them for work on Ulrich and collagen 6 disorders. So again, Gary, I know, will be delighted to hear that. And so international collaboration, a new development for us. And if we look at research, the commitment we made in the summer, more than £1 million for new research projects, 10 projects. We've now secured co-funding from some partner charities to go with that. So building this alliance, building the partnership we're keen to see. And they cover 8 conditions, not a single focus, 8 conditions. And there's a wide range of approaches being tested here. Stem cell research, gene therapy, therapeutic approaches more generally, and even a quality of life study as well, which will probably see more quality of life work as we go forward. I wanted to show you this slide because it's, I think for me, a really important slide, which shows the work at Oxford. And it shows the partnership with Summit PLC at the top right there, who've got a product for Duchenne in clinical trial now. It's a utrophin-based product. And there's now a Utro-DMD alliance, and we're there on the right, I think, with the American, our sister charity in America, on the left of that. So an international collaboration with a biotech company looking to take a potential treatment forward. And right in the small print at the bottom, there's a reference to Dr. Graham Wynne, who was doing a cycle ride for us, who raised up well over £1,000. And I do like that, again, that partnership. And I like it so much that we engage with clinicians who will run for us, or researchers here who will carry out a cycle ride for us. So the charity is open and accessible and engages people. And we spoke earlier about the staff, and I do want to say too, my thanks to the staff group, who are a fabulous team, make my job easy. But you know, I always think it's important you bear in mind the staff also run marathons. They carry out long-distance cycle rides. They skydive too. They run the half marathons, from directors to the less experienced members of staff. Many of the team are involved in the fight with us in this way. And that's important to bear in mind, because there's not so much then a divide, is there, between paid staff and volunteer staff. The staff are volunteering too. I'm really grateful that they do that for us. So I want to move on now to start to draw to a conclusion. And so emerging treatments coming through from clinical trials, from research we funded and other organizations have funded, still have hurdles to overcome. There are still delays in the process. In the jargon, it's about regulation and reimbursement. So when a potential treatment has come through phase 1, phase 2, maybe even a phase 3 study, sometimes a phase 3 extension study, we're getting familiar with the jargon now, so we're working at the sort of therapeutic end of the research journey, I guess you could call it. When we come down there, we then have to take it through what's called the EMA, the European Medicines Agency, and when it's gone through there and been approved as safe and reliable, we then have to make sure the NHS will provide it. And there's a sense in which the NHS will take some time to consider a drug that's already been approved for use by the European Medicines Agency. And so ataluren is the first treatment coming through. It's called Translarna now, it's its trade name. It's been approved in May by the CHMP as part of the European Medicines Agency, finally endorsed in August. Very good news. This is the first treatment for Duchenne that tackles the underlying mutation, albeit just for a subset of boys, those with what's called a nonsense mutation. So it should delay progression for between 10 and 15% of boys. And I say boys, it's been tested with boys aged 5 and above who are still ambulant. So that's its sort of target at the moment. But now it has to get through the NHS, so it's cleared the first hurdle. And it cleared that first hurdle at the end of September. So that's good news, isn't it? But there are now 4 more hurdles to go before the NHS will decide at the end of December whether it will be funded by 1st April. So you can imagine the difficulties that we're facing in taking emerging treatments through. So we are looking now to support what I call here the clinical infrastructure, the centres required to deliver and monitor emerging treatments. And we need to get information about new treatments out to families and patients, and to the doctors too, who have a role to prescribe and to monitor and to take forward. So having described the problem, what are we doing about it? Well, we do have a really effective parliamentary profile, a parliamentary programme. And Gary spoke earlier, didn't he, about meeting the health minister. 3 years after forming his family fund, he's there with the health minister, which is great. I mean, we can do that. We can give people a voice and a platform. That's what we're here to do. And so here, we called in a parliamentary inquiry we launched, we called for a long-term rare disease fund and extra funding for new drugs. So one of the features of drugs for our conditions, these very rare conditions, is they're likely to be very expensive compared to so-called blockbuster drugs. And therefore we need to look at how they're going to be funded as we go through the NHS. Because, you know, from the charity's point of view, we're quite clear. We've not been here for 50 years and longer, spending more than £50 million to be told at the end of the day, you cannot have life-saving drugs because they cost too much. We're not going to accept that. You know, we are here to defeat these conditions, and we're not going to stop until we get through this. And so we call for the long-term rare disease fund, and we call for extra funding for new drugs. And we've had a good response. So there is now an early access to medicines scheme launched by the MHRA. There's now an adaptive license pilot coming through from the European Medicines Agency. And in Scotland, there's been an announcement that there will be a new medicines fund with a doubled pot of money behind it, £40 million. So we're working to drive all this forward. And if I draw my remarks to a conclusion now, what I would say is this. We are on a journey, aren't we? We've come a long way from the time when having the diagnosis was a moment of complete and utter despair. It is still completely distressing when you hear this, isn't it? We understand that, we get it. We know it's one of the days you'll never forget. But we are making real progress. It's not fast enough yet. We haven't gone far enough yet. We're going forward. And we're looking to build, again, this huge partnership, this alliance to win our fight. And I speak about our branches and the committees, the family funds and our muscle groups. We've got wonderful eventers raising hundreds of thousands of pounds for us. We've got companies and trusts, again, who donate and support us. And we've got people, I mentioned earlier, people who leave us generous bequests in their wills. We've got partners in every field, from science to clinical care. Partners doing lots of things for us, people who work with us in Parliament. And so I need to thank all of those people and to thank each and every supporter. Because we know that every day counts. Muscle fibers once lost can't yet be created. Every day people get weaker, but we are moving forward. We're building partnerships, aligning the field together. More than 13 charities now working closely with us with agreements, with understandings. We're joining forces. We've got a louder voice and a growing impact. We are determined and committed, and we're closer to our goal to defeat muscle wasting conditions. Thank you very much.